Why arousal is not consent. Hey guys, this is Michael Pizzullo. I'm a psychotherapist here in West Hollywood, founder of the Gay Men's Sexual Trauma Treatment Network. So when we talk about treating trauma, it's obviously a complex topic, and then sexual trauma is more complex. And then when you're talking about specifically gay men who've experienced sexual trauma, you're really getting into a lot of nuances and details that are often overlooked. When it comes to treating this issue, the most important thing to address that often goes unaddressed is arousal. And what you're gonna find when you do this work, or if you've experienced this, unfortunately, is that a lot of people that experience sexual trauma experienced some sort of arousal during the trauma. And what that leads to is a lot of shame and also a sense that they consented to the abuse that they endured. So this is gonna be very important to address in therapy, and that you're gonna wanna work through or bring up with if you're working with someone who's experienced sexual trauma. So just to backpedal and help people understand, arousal is absolutely not consent. And the truth is that our biology is often quite confusing. You know, the mechanisms for sexual excitement and then fear often kind of get intertwined and mixed up. And you see people play around with these dynamics on purpose if they do some sort of like BDSM or kink dynamic or whatever, where they, add fear can often fuel the body's sexual arousal responses. But as we all know, sexual arousal, particularly for men, is often very, involuntary. We experience like involuntary erections, in the bathtub, on an airplane, or in the morning, or whatever it is. Someone touches your arm, it might feel good even if you didn't ask them to touch you. So I think we want to really normalize that we don't have full control over our bodies, we don't have full control over our sexual responses, and that even if someone, approaches us or assaults us in a way that we don't like, there may be a part of our physiology that responds to it with fear, but also with excitement, and again, maybe with some arousal. And so this is going to be something that's so important to address in the therapy process, to know that it's not your fault if your body responded that way. It's not even your fault if your body responded positively to the point of even completion or orgasm. Again, those things are super common and by no means indicate that you wanted the abuse, that you enjoyed the abuse, or that you're somehow complicit in the process. So really want to debunk that myth and offer that to you if you've experienced this type of trauma, because that kind of belief system just leads to so much shame. And it's often something that people are too embarrassed to bring up. And so they may go through lots of therapy, but never address one of the most shameful components of the experience. And it's a big miss. And they're left feeling, unsettled or anxious or with low self-worth, or all kinds of other, post-traumatic symptoms just persist because they haven't gotten to one of the roots of the trauma. So if you need help, if you're a gay man, if you've experienced sexual trauma, we've just launched a new network partnering with Impulse United called, again, the Gay Men's Sexual Trauma Treatment Network. I'll put the link in the video. It's a one-stop shop for gay men who have experienced something like this, where you come to us and we'll do an assessment, and then we'll give you everything you need. We'll give you therapist, psychiatrist, coach, trainer, doctor, everything. We just want it to be think like a simple network, so that when you go through something like this, it's so overwhelming, and the last thing you want to do is have to scour the internet looking for resources. So we want to make it as simple and as seamless as possible, so that you can get to feeling better and confident and just happy again as soon as possible. So if you're curious to learn more, please reach out and we'd be happy to talk to you.